Sperm counts are going down globally. Fertility rates are going down globally. So this is going to become a big issue for people. Probably in the next 30 years, you're going to probably see a majority of people having to use some sort of assisted reproductive technology to get pregnant.
Why do so many men wait until something goes wrong before they start thinking about sexual health? Our guest today is Dr. Joshua Gonzalez, a board-certified urologist, sexual medicine specialist, and co-founder of Popstar, a company helping to modernize the conversation around men's sexual wellness. Through his clinical practice and public education work, he helps men navigate everything from erectile dysfunction to hormone health to performance anxiety, confidence, and intimacy. In this conversation, we explore why men avoid sexual health care, what most people misunderstand about men's sexual health and fertility, and how we can help make these conversations more accessible, proactive, and stigma-free. Welcome to the lab. Welcome to Sexology Lab. Each week, we speak with the most compelling minds in modern sexology to ask the questions shaping the future of desire, connection, and human wellness. Let's dive in. Welcome to the lab, Dr. Joshua Gonzalez.
Hi, thanks for having me.
Thanks for being with us today. Now, where in the world are you joining us from?
So I'm in Los Angeles, California, where I was born and raised.
Amazing. Now, you're a urologist, and I'm curious, what is the biggest misconception that men have about sexual performance?
Sometimes I think people feel kind of alone if they're having problems with sexual performance, and they think that they're like the only ones experiencing that, especially when you talk about younger men. One of the biggest misconceptions I run into is people thinking that their story is somehow unique and that nobody else in their peer group or something is dealing with the same issues.
Yeah, that's really hard and probably really lonely too, to think that you're the only one going through this. Do you think men are more anxious about sex today than they were like 10 years ago?
I would probably say yes. I think just in general, people feel more anxious about everything because of like things going on in the world. But in all actuality, things like the pandemic and a lot of the socio-political upheaval that has happened in the last like decade or whatever, I've seen that manifest as an increase in sexual dysfunction. And it makes sense, right? Like if you're stressed about what's going on in your environment, it's going to definitely have an impact on your sexual function. And so I think that definitely translates to anxiety. And then on top of that, you have the sort of birth of social media and people constantly comparing themselves to other peers and other people in their friend groups and all that sort of stuff who they see online. And it's a very like sort of filtered, curated view of someone's life. But if you internalize that and compare yourself to that, it can sort of make you feel inadequate and anxious about not keeping up.
Yeah, and that's what I was thinking too. Like with the rise of social media, there is so much comparison and you're like only seeing someone's highlight reel. You're not seeing their everyday life, and it might make people feel inadequate.
Yeah. Exactly. I think the flip side to that is that I do think that it also has allowed some people who would have probably stayed in the shadows to learn more about what they're experiencing. There's some positive aspects to that where patients feel they can get information more readily than they would before. Maybe sometimes even before they come and see the doctor, so that they gain some knowledge about what they're sort of experiencing, and then they can come in and feel more comfortable having a conversation about it.
Yeah, and that's true. And there are a lot of experts on social media like you providing really good quality education to people that maybe they wouldn't have had access to like 10 years ago.
That's right. Yeah.
Okay, now I'm wondering, what are some of the biggest sexual health concerns that men bring into your office?
I would say the biggest one would probably be erectile dysfunction, which is incredibly common. We see the incidence go up with age. So the numbers that we often quote to patients is that 20% of men in their 20s experience erectile dysfunction, 30% in their 30s, 40% in their 40s, and it goes up about 10% with each decade of life. So it's incredibly common, especially as people get older. Changes in libido is a big one. I have a pretty big patient population that struggles with chronic pelvic pain, just sort of generalized like hormonal issues, patients coming in reporting that they don't sort of feel like themselves, they have chronic fatigue. So a lot of what I do will involve hormone treatments as well, not only to help men feel better, but also with the goal of sort of optimizing their sexual function along the way.
When the men come into your office, are they saying, I have a performance problem, or are they like naming what it is exactly that's going on, or what are they saying to you?
Yeah, I mean, I try to create an environment where people feel comfortable being specific about what their issue is. There are some patients that still come in with a certain amount of shame or maybe just embarrassment, or maybe they don't have the language to describe what they're going through, or they don't understand what the problem is, or have an incorrect idea of what a certain definition means. For instance, erectile dysfunction. Many men think that if they can get an erection, that they don't have erectile dysfunction, even if they may have trouble maintaining. But the definition of erectile dysfunction includes both of those. You need to be able to get an erection and maintain it. So some guys won't use that language. I use our time together to kind of educate them on these definitions that we have. And then if there's someone who does seem a little bit shy or reserved and or they don't have the language to speak on what they're dealing with, I will often ask them, is it okay if I ask you some pretty specific and direct questions? It'll help me understand more about what's going on with you. That's often useful because it kind of pulls the information out from them without them having to name it if they don't feel comfortable doing so.
Yeah, and a lot of times you find that it's more physical, more psychological, or a
Mhm.
solid combination of both.
Most cases is both. And it makes sense if you're somebody who is suffering from erectile dysfunction or you have low sexual desire. That can cause problems with self-esteem. That can cause problems in your relationship. And those anxieties, let's call them, create this sort of vicious cycle and make those problems even worse. If you have a couple bad encounters where you have problems with your erections, you then get in your head about it. Maybe your partner says something to you that makes you feel insecure. And then even if you could potentially have a normal erection the next time, you start avoiding sex and you continue to have trouble.
And I mean, overall, would you say that like sexual confidence and insecurity is a major issue for men?
I think so. Yeah. I mean, a lot of men think that they have to be hypersexual all the time. They have to be able to perform all the time. And when that doesn't happen, it's just a function of living.
Yeah.
Sometimes you're stressed out. Sometimes you're tired. Sometimes you're just not in the mood. Like those things are okay. But men feel like they have to live up to some sort of masculine ideal. And I think a lot of that is informed by culture in general, what they see in popular media, what they see in pornography as like how they're supposed to be. And it's something that I really try to get away from. If someone asks me if they're normal or if this type of problem is normal or if they masturbate this much, is that normal? I tell them like, I don't like the word normal when we're talking about sexual function because it's so specific to the individual. When it becomes a problem is if it's causing you personal distress or it's causing issues in your relationship. If you are someone who has for your whole life not been particularly horny, that's not inherently an issue, right? But if
Yeah.
it's something that you once had and it's now gone away and it's starting to affect how you feel about yourself and how you see yourself in your relationship or your partner's being bothered, then that's when I can help.
All right, so I want to talk with you about premature ejaculation. So it's a common
Okay.
concern with men. How common is it really?
Some literature says it's the most common sexual dysfunction in men. Up to 30% of men will experience premature ejaculation at some point in their life. So it's pretty common. I think some people also have some misconception around what the actual definition of premature ejaculation is, right? I get a lot of guys coming in saying, oh, I think I have PE because I ejaculate within 5 to 10 minutes of sex. And I'm like, dude, you are normal. That is
Normal, yeah.
Even though I
know,
don't like
right?
to use that word, that is normal. And if you're lasting 10 minutes, it's actually above average. So helping people understand that at least the textbook definition is ejaculation in most instances within a minute helps them kind of reframe how they think about ejaculatory latency time. That said, it's still bothersome to patients if they feel like they're losing control of their ability to stave off ejaculation, right? If they feel like ejaculation is out of their control, we might not textbook call that premature ejaculation, but it's diminished ejaculatory control, if we want to call it that. And we can still talk to them about treatments, off many of which we employ in the traditional cases of premature ejaculation to help them get better control.
Yeah. And like you said, men might get an idea from porn that they're supposed to last for an hour, and then they get distressed if it's 5-10 minutes. And so what can men do? So what are some of the things you do in your office to help people if they want to last longer?
So, I mean, we first try to rule out any potential physical issues that may be present, right? So we'll often do a hormonal assessment. If they have erectile dysfunction alongside the premature ejaculation, many times if you address the ED, their premature ejaculation normalizes. If they have ED, we'll often do a vascular assessment to see if they have any blood flow issues. I think asking them about what kinds of situations this occurs in is really helpful to guide your treatment plan, right? So is this a lifelong thing or is this acquired? Was there a period of normal ejaculatory control and now things have changed, or has this been something they've struggled with their whole life? Does it occur when they masturbate or is it just with partners? That can kind of clue you into like treatment options for them. So obviously if we find hormonal issues or problems with blood flow, we like optimize those things. If it's someone who's dealing with premature ejaculation as a lifelong issue, many of those men will need medication to treat the issue. We kind of think of it as like a hardwired brain problem, right? And so things like start-stop technique, working with sex therapists or even pelvic floor physical therapists to try to get better control is often not that helpful for guys with lifelong PE because it's more a brain issue, not necessarily a behavioral issue or a muscular problem. There's no FDA-approved drugs for this condition, but we use a medicine called Paxil, which is an SSRI antidepressant. Most commonly, it's got pretty decent data showing improvements in premature ejaculation. And the reason it works is that one of the side effects of SSRIs is delayed ejaculation. In this case, we kind of use a side effect to our advantage to help men get better control. There's another medication called tramadol, which is a pain medication that we use sometimes as well to sort of disrupt the signal between the genital stimulation and the brain. It's taken differently. Paxil is something that's taken every day in most cases. Tramadol is more of an on-demand treatment. And both medications have side effects that we discuss with patients and figure out what makes the most sense for them. If they have a regular partner and sex is more planned than not, sometimes they'll prefer to take an on-demand treatment. Whereas if someone is single or has multiple partners and sex is not planned, then sometimes a daily medication can be more helpful.
So is this course of treatment for someone who like you officially diagnose, who's like ejaculating in 1 minute or less? Or is this for somebody, just anyone who's coming in and saying like, okay, I'm lasting like 5 minutes, but really I want to last like 20 to 30?
It's a little different. I mean, I tend to reserve medications like Paxil for the sort of lifelong guys. I guess even acquired guys who more classically fit the definition of premature ejaculation, mostly because Paxil, one of the side effects is that it can affect libido in a negative way, right? And that's a sexual side effect that we talk to patients about. But for guys with premature ejaculation, that's been a lifelong issue where they cannot last longer than a minute. Oftentimes, they're willing to accept a slight decrease in their libido for better control because then they can enjoy sex more. And there's some medications that we can add to Paxil to offset the libido stuff. But because of that, I tend to reserve it for sort of the classic definition guys. If somebody is wanting to last longer, especially if their ejaculatory time is what I would consider average or even above average, and they just want to last longer, some of those guys, those are the guys that I refer to, sex therapists, sexological body workers, and people who work more on, I guess, the sort of mechanics that I'm not really there to treat, or the behavioral stuff to teach people how to be in tune with their body and take breaks when they need to, over time, get better control. Those are the guys that I tend to refer out to.
And I'm wondering too if you almost ever have the opposite side of the spectrum happening. So if men are coming to you and they're saying like, I'm having issues, it's hard for me to ejaculate, I'm having difficulty with that. And then you find out they're on an SSRI and that's what's causing it. Do you see that in your office?
We don't have a ton of good data on delayed ejaculation, but I can tell you it's probably a bigger problem in my practice than premature ejaculation. We know that it increases with age, right? So it becomes harder for men to ejaculate as they get older. It's probably a function of lots of things, right? Changes in sensation, decrease in hormone levels, diminished blood flow to the penis. There are medications, as you mentioned, SSRIs can cause that. So there's a lot of reasons that men can have trouble achieving ejaculation and orgasm. And again, sometimes it's an acquired issue that happens as they get older or for other factors that they encounter in life. And other times it's a lifelong issue where they've just always had trouble ejaculating. And again, we try to get to the bottom of like whether or not this is situational. Is it something they only experience with partners? In those cases, I'll often refer them to sex therapists and other people in that field to figure out where the disconnect is between partners and masturbation and why it's hard for only that one situation for them to ejaculate. If it's a global problem, then a lot of times we're having to use medication therapy as well. And again, as with many things in sexual medicine, there's no FDA approved drugs for this. So a lot of stuff we'd use is off label.
Do you think that men are talking about this amongst themselves, like about these different sexual health issues that are coming up?
No, I mean, at least not in person. I think one of the things that happens is that some people are very online about these topics, right? Like there's Reddit forums and there's these other men forums where people, I think, anonymously share what they may be going through and people offer each other solutions. But I think in general, men are not great about talking about their health. I mean, this is not just sexual health, it's just like health in general. They're not great about seeing doctors. They don't interact with the healthcare system in the same way that women do from a very young age. And so it's unfortunate that men aren't more open about these sorts of things. I think I understand a little bit why. I mean, I think, again, going back to like the sort of masculine ideal, men feel emasculated sometimes when they're dealing with these issues, and they certainly don't want to admit that they're dealing with it to friends, right? Because they assume that their friends are fine, even when their friends probably are also in my office, complaining about sexual dysfunction. But they feel like if they say it out loud or they talk to a friend about it, that's admitting that there's something wrong with them, and that makes them somehow less masculine.
How do we change that? What can we do to make that better?
If we can shift the narrative to encourage men to think of them taking their health seriously as the most masculine thing that they can do, that would help. If you are a man and you prioritize your health and you prioritize your sexual health and you seek out treatment when you're struggling with a health issue, that allows you to be a provider. It allows you to be a husband. It allows you to be a better father. It allows you to be present more because you're taking care of yourself. And I think shifting that narrative. I don't know how to do that. I wish I had that
Yeah.
answer. I think it's pretty complicated. But I think
Yeah.
culturally, if we encourage men to take their health more seriously as a form of masculinity, people would come in to see me more often.
Are you curious about sexology? Do you want to further integrate sexology into your work or your life? Well, friends, then we've got something just for you. It's called the Sexology Practice Guide, and it walks you through the ways this shows up in your work, in your life, and guides you through working within your scope, incorporating intimacy and sexual health into your work without starting over. Download this short, practical guide at sexologylab.com/guide. That's sexologylab.com/guide. And while you're here, make sure to subscribe and share. And now, back to the show. So, if somebody's listening to this today, like what would you recommend for them to start the conversation with their friends?
It sort of depends on the person's age. As men get older, they start to, even if they're resistant, having to interact with the healthcare system and start to take their health more seriously because it's starting to decline, right? So I think it's easier for maybe middle-aged or older men to have those conversations like, oh yeah, I had to go in to get my colonoscopy or I had to get my
Yeah.
prostate exam or whatever. They're a little bit more open to talking about it. I think the real challenge is with younger men because again, I think they feel like I'm too young to have any problems. I don't want to talk to my friends about it because they're certainly not going through any of that. And so I think one of the things that I always try to encourage patients in my practice is like, don't wait until there's a problem. Like in your 20s when things are working really well, that's when you should start to work with someone like me so that you can continue to preserve that function. It's much
Yeah.
easier for me to see somebody who's doing pretty well, or maybe they had a couple instances where there was a problem, but it's not all the time. It's not a consistent issue that they're facing. Those are the best people for me to work with because then we can talk about strategies, diet, sleep, exercise, all the things that help promote testosterone production, hormone production, release endorphins, all of these things that are good for your health and your sexual health. That's when I should be interacting with these patients, not when they've had erectile dysfunction for 10 years. I mean, I can still help those people, but it's a much
Yeah.
easier job for me. And the outcomes are often much better if someone's coming to me proactively, wanting to preserve their function rather than gain it back if it's been gone for a while.
Totally makes sense. So if there's a man in their 20s listening to this, we want you
Yeah.
to know, start the journey now if there's an issue or just establish a relationship with a
Yeah.
provider.
Yeah.
So do you ever get to watch the trajectory of people building more confidence as they come into your
Mhm.
office and things start to get better?
Yeah, I mean, I think that's one of the most rewarding parts of my job is seeing those victories and seeing how profoundly it can change someone's life. It
Yeah.
changes how they feel about themselves, their self-esteem. People often start working out more and they start pursuing relationships when they were previously avoiding them. If they're in a relationship, they come in saying things like, you saved my marriage, or my wife has never been happier, or my partner's never been happier. Like, those are the moments where I feel really rewarded because I can have such a dramatic impact on someone's life. Seeing those success stories, they literally will come in day one, sluggish, slumped over, whispering, and then to
Yeah.
see them change within several weeks or a few months and they're coming back, holding their shoulders back, head held high. It's really the most exciting part of my job, I think.
So incredible. That's really cool to
Yeah.
hear. Now, Joshua, I like the shirt you're wearing today. Could you tell me what is Popstar?
Yeah, Popstar is a men's sexual health company that my partner and co-founder Brian Steichner and I started back in 2020. It's just sort of like a COVID pandemic pet project. When the world sort of shut down initially, there was obviously no one was coming to the doctor. So I had a lot of time on my hands. And I had been thinking about this idea for a while of starting a supplement that would help increase men's ejaculatory volume because I was seeing a lot of patients in my office complaining of how a decrease in their ejaculatory volume was having a negative impact on their sexual life and their sexual pleasure. In medicine, we don't ever really prioritize ejaculatory volume outside of reproduction, but that's not what people were coming to me complaining about. It was more about like, how do I get this back? Because when I ejaculate more, sex feels better. I want sex more. It's more fun for my partner. There's some medications that we have that can help achieve that, mostly again for reproductive purposes. But a lot of people don't want to take medicine for this issue. So they would ask me, what can I take that's natural or there's supplement on the market? And at the time, there really wasn't anything available that I thought was safe and or effective that I would recommend to patients. And so I talked to Brian and I was like, I have this kind of crazy idea. Like, what do you think about us creating creating this product. And so we just spent like months and months putting together the formula for the initial volume and taste enhancer supplement and took our time launching this company. We launched the product in 2021 and it's done very well. And since then, we've expanded to other offerings. Initially, we had a lot of patients asking if our volume and taste enhancer would improve their fertility. And while there was some ingredients that can help improve fertility, it wasn't a fertility specific supplement. So we then developed a fertility specific formula. And the products that we've launched since then have all really been focused on real world problems that Brian and I see in our office every day. Brian's also a urologist who has a strong background in men's health as well. That's been our guiding principle with the products that we decide to bring to market is really what are our patients asking for, that their needs are not being met with products that are out there. How can we improve on what is out there already from a doctor lens? All of our products are formulated by Brian and I ourselves. There's not a lot of sexual health and wellness brands out there that are formulated and doctor run. That's one thing that sort of sets Popstar apart from other competitor brands out there.
Yeah, that is amazing. You have other products too?
Yes, so we have a line of lubricants. There's a silicone and water-based lube. We have a delay spray. Speaking about premature ejaculation, one of the treatments for premature ejaculation are sort of topical numbing sprays. Historically, none of them have been great. We like ours because it's a higher percentage lidocaine that has a non-transfer technology, right? So one of the complaints that people have having used these products is, well, it numbs my penis, but it also numbs my partner. Our product does not do that. And you don't have to use as much because it's a higher percentage. It doesn't completely numb the nerves. It just sort of desensitizes them so that you still feel something. Sex is still enjoyable, but hopefully that slight desensitization will give you better control. We have a line of boosters that are coming out. I don't know when this podcast is going to come out. They may be available by the time it comes out.
Yeah.
That are focused more on other problems that we see. So we're going to have a testosterone booster, something that is going to help with erections specifically, and what we're calling a refractory supplement to decrease the time between sexual episodes that men experience. That is something that increases with time. So as you get older, your refractory time gets longer and longer and longer. And many men get frustrated by that. And so we've created this line of boosters that we think is pretty cool because it's going to be something that you can add on to the volume and taste. So they act synergistically together.
So are these products available to anyone, or do you need a prescription, or how does that work?
Yeah, so they're prescription free. They're over the counter. The easiest way to get it would be through our website, popstarlabs.com. The website is great. I mean, we designed it not just as like a shopping experience. We have a blog there where people can learn about all kinds of sexual health topics. So I would encourage people to just like go to the website to just learn about sex, because there's a lot of topics that we cover that people may not feel comfortable asking their doctor. And then we sell all of our products through there. We're available on Amazon as well. And so, yeah, I mean, people can get them without a prescription. I would suggest, people discuss these with their providers, as with any supplement, right? You want to always run it by your provider to make sure there's nothing in our ingredients that would counteract with maybe a medication that they're taking. All of the stuff in our supplements is all natural, but there are some all natural ingredients that can interact with certain medications. So you always want to bring that up to your provider.
Yeah, that's really good advice. I'm curious more about the fertility supplement. Do you have like a lot of men and women coming into your office together about fertility issues, or is it usually just the man that comes in by himself and is like, I'm not?
It's a little of both. Depends on where they're at in their sort of fertility journey. Like sometimes we'll get heterosexual couples coming in together where they're kind of early on, they're exploring what their chances of getting pregnant are. And then other times we have male patients sent in by like a reproductive endocrinologist who is already working with the female, and they want to make sure that there's no male factor involved. So they often will come in for semen analysis testing, hormonal testing, just to make sure that the male is optimized, because they're already in the pipeline to do assisted reproductive technologies.
If man and a woman are trying to get pregnant, would it be a good idea for him to just start taking this supplement?
The thing is like, we know globally that fertility rates are dropping. That's happening all around the world. We always encourage people to be proactive. If you're 25 and you're certain you don't want to have kids for 10 years, great. Live your life, do your thing. You might want to just talk to a provider to just see where you're at as a baseline, because that's the best your sperm is going to be. It's only going to get worse from there. So you don't want to be a man in a situation where you're like in your late 30s and 40s and you're finally ready to have a family, and then find out that your semen analysis is off. There's, of course, things that can be done, but it would be better for you if you figured that out earlier and started doing things proactively that involve maybe supplementation, doing things lifestyle wise to optimize your sperm production at a younger age. So I don't think it's necessary that like every 25-year-old take our fertility supplement, but it
Yeah.
might be a good idea for a guy in that age range to just get a baseline semen analysis. And if there's something off, then yeah, I think incorporating something like our fertility supplement could be really helpful.
Yeah, that's good advice. Yeah, I know people going through fertility journeys, and I'm just going to send them all to your website so they can just check it out.
Thank you. I mean,
Yes.
it's going to becoming increasingly a problem. I feel like 20 years ago, you would sometimes hear about people going through fertility struggles. It's become way more common in my life. Like I hear people talking about it more. It's going to become more the norm than not because we're having kids later and later. As I mentioned, on top of that, sperm counts are going down globally. Fertility rates are going down globally. So this is going to become a big issue for people. I would say probably in the next 30 years, you're going to probably see a majority of people having to use some sort of assisted reproductive technology to get pregnant.
And so what's going on? Like, what have you found?
Yeah,
Like,
good
what's
question.
causing this? Yeah.
I mean, I think a lot of it's environmental and it's not just local environments because again, this is a global problem. So something is happening in our environment. Maybe it's stuff that's in our air, microplastics, chemicals that we become in contact with. I think all of that's at play because it's not just a decline in sperm production. Like we're seeing a decline in male sexual and hormone health also globally, right? So testosterone levels are declining. We're seeing higher rates of erectile dysfunction and other sexual issues that men are facing. You can be the healthiest person possible. You can do all of the things that we ask you and get 7-8 hours of sleep, eat a heart healthy diet, exercise regularly, and still you can't avoid interacting with your environment. That's why even if you think of yourself as a really healthy person, I always would encourage someone to get a baseline testosterone level while you're young and things are not a problem. Get a baseline semen analysis to see where things are at, even if you're not ready to get pregnant, just so you can know where you stand. There may be a problem before you think there might be.
And what do you recommend? You're talking to a guy in your 20s. What would you say? Avoid this or do this? You know, what would you tell them?
I mean, it's really hard because all of the things that I would tell that person are all of the things that we don't do in our 20s. Avoid alcohol, don't smoke, sleep 8 hours a night, eat a heart healthy diet. It's like kids in their early 20s, they're living their life, they're going out, they're drinking, they're partying. At least they did when I was that age. I don't know if they're still doing that, but I mean, like, we're not in our 20s leading the healthiest lifestyle. And ironically, that is probably when we should be to preserve all of these bodily functions that are important to sexual and reproductive health. I don't know if it would fall on deaf ears, but I would tell people to avoid ingesting toxins like alcohol, which it is, cigarette smoking, eating healthy, sleeping well, exercising regularly. And then as much as possible, you know, if you're talking about fertility, not going in hot tubs all the time and like cooking your sperm, avoiding microplastics as much as possible, but that's impossible. It's going to be impossible for most people to do that. So you can only do the best you can do.
All right. I would love to wrap things up with a very quick lightning round.
Okay.
All right. So I have a couple questions for you. What's the most common sexual health question that men are too embarrassed to ask?
Related to like penis size or just like if their penis or genitals are like normal? Like I get a lot of people feeling insecure about size and the appearance of their penis. And I always try to tell guys that I see penises and vulvas that are like snowflakes. Like they all look different, right? And they're all like special and unique in their own way. And so, yeah, I think ideas about what is normal appearance, what is normal size is a lot of guys are sort of embarrassed to talk about that.
Yeah, I can totally see that. That was a good one. What's more important, confidence, communication, or technique?
I would say communication. I would go back and forth between confidence and communication, but I think ultimately, like if you're a really confident person, but you're not communicating with your partner, it's still not going to be good. I would say communication for me is probably the number one.
All right, last question for the lightning round. What's one thing every man should know about sexual wellness before the age of 30?
That's the time when you should start talking to your doctor about how to optimize your sexual health. Because even if you're someone who's not having an issue at that moment, that's when you should start seeing somebody about it. That it's never too early to kind of take your sexual health and wellness, you know, seriously.
All right. My last question for you. You presented with our sponsor, Sexual Health Alliance, last year. So what was your experience like presenting with our group?
It was fun. I mean, I think it's always nice to be able to talk about my expertise and sort of how I have used my training to build a practice and take care of people and help address a variety of sexual health issues. And the perspective that I have coming from my medical background pairs really nicely with a lot of the people in Sexual Health Alliance who are approaching sexual health from a different lens, right? And so they may not have the physiology background, the hormonal understanding, and those sorts of things. And so I've found that when I've given talks to communities like Sexual Health Alliance, or every year we'll give a talk to the UCLA psychology department when they're doing their sexual health module, they sometimes come up to me and they're like, oh my God, this was so helpful because we never go over the pathways involved in testosterone production and all of these sorts of things that are sort of more basic sciencey stuff, but inform a lot of what I do every day. Yeah, I found it like a very rewarding experience. And the people in the talk, I think, learned a lot.
Yeah. Oh, definitely. Yeah. And I think there needs to be more crossover. From the therapist side, we love having more medical information. And then I've also seen a lot of people on the medical side saying, like, hey, I need more sexual health information. I need more of this crossover.
Yeah. Sexual health is or should be collaborative. I often form what I call these little villages, right? It takes a village to help someone, or, and so biological, physiological issues. But there's going to be anxiety for the reasons that we talked about. There's going to be relationship issues. There's going to be pelvic floor dysfunction. And so a lot of times I have to work collaboratively with therapists, with sex therapists, with pelvic floor physical therapists, with gynecologists, with primary care providers. And it takes a group of people to really help someone in a comprehensive way.
All right. Dr. Joshua Gonzalez, thanks for joining us in the lab today.
Thank you. Thanks for having me.
You're welcome. Bye, everyone.
Bye. Take care.
Don't forget to subscribe on YouTube, Spotify, Apple, or wherever you listen. Links are in the description below.